even in the 70s when I was born, they did not give us 30 doses of vaccine in the first year. I received some vaccines, and most of my generation have, and that generation didn't have 1 in 50 autism rate. And in those days, there were no big epidemics of so-called vaccine-preventable diseases. So even if they would have the common sense and say, let's go back to what we did 30 years ago and see if that solves the problem. But no, they want to push this policy, one size fits all. And you either have to adhere to the CDC mandated schedule or, well, now they want to force it on everyone. We're not saying stop vaccinating, but stop selling lies that these things are absolutely safe and that serious side adverse events are so rare that you don't have to worry about them. It's a lie, because the proper type of research to answer that question has never been done.
Vaccines, certainly a highly controversial topic at the beginning of 2015. Hi, this is Dr. Mercola, helping you take control of your health. And today, we are joined by Dr. Lucija Tomljenovic, who is going to talk to us about the effect of vaccines on your brain. So welcome, and thank you for joining us today.
Thank you, Dr. Mercola.
So perhaps you can review with our viewers your specific training. I guess you're a postdoctoral fellow and with a PhD in biochemistry, and perhaps discuss that a bit, and then how you got first interested into this area of research.
Well, yes, I'm a postdoctoral fellow at the University of British Columbia, and I work in neurosciences and the Department of Medicine. The reason why I got interested into this area is because there is lack of research demonstrating safety. When one reviews the most of the pharma-based trials on safety of vaccines, you will see that they either use another vaccine as a placebo or the aluminum adjuvant, and neither of those constitute a proper placebo. So it's very easy to claim that the product is safe if you're using a comparator that inherently might be toxic. And again, the reason why, there's a bigger reason behind why I start being skeptical about what's being reported in peer-reviewed literature. It's because early in my career, I had the, I wouldn't say an unfortunate experience, but I got confronted face-to-face with corruption in science, because I was asked by my former boss to actually falsify data on an experiment we were doing with statin drugs, the supposed cholesterol-lowering drugs. And we were testing these drugs in mice, and more mice were dying from the statin treatment than from the water treatment. That was the proper placebo in our case. And so when the results came, my boss told me to ignore the dead mice from the statistics because it wouldn't look good on a drug. And I thought then to myself, I didn't have to get a PhD degree to lie, to earn money. So I quit my job and I started questioning what else have been sold in science as truth about safety and efficacy of drugs, if this is how research is driven. Because my boss was receiving money from the drug companies, and obviously they would have not given more money to a lab that published unfavorable reports about their drugs.
Absolutely. Well, there's the whole story in itself, and congratulations for having integrity and really acting on that, and probably a great sacrifice to yourself personally. So that's a rarity also that we find in the sciences. So you're certainly to be commended for that. I'm wondering if you have any speculation as to how the researchers and the peer-reviewed journals who review these studies could actually allow such an improper placebo when testing vaccines? Do you have any ideas? I mean, any speculations?
I think money talks. I mean, it's being used. It's been used for the aluminum adjuvant has been used since for about 90 years now. And the fact is that when it was first approved to be used in vaccines, it was only approved because of efficacy, but they never tested it for safety. They put this limit of, I think it was 850 micrograms, but a total limit. But this was based on efficacy data because that amount was found to be, stimulating the adaptive immune response that they wanted. And so they went for that, but they never really tested it for safety because they assumed it's safe. So again, I have a document from 2002, and this was, from the FDA, and they were actually discussing the, assessment of vaccine ingredients in preclinical trials and testing specifically in animal models. And this is a paper from 2002, so it's not from the Middle Ages. And back there, they stated that the routine toxicity studies in animals with vaccine ingredients have not been conducted because it was assumed that these ingredients are safe. I mean, when I read that, I was just kind of pulling my hairs out. It's like, so this is your indisputable evidence of safety. But
yes.
These papers, these documents never make it to the mainstream media. So it's just a lie perpetuated over and over again that, we've been using these things for over 9 decades and it's been proven safe. It's like, no, it's been assumed safe.
Yeah, actually that is the answer to my previous question, because there was a false assumption of the safety. So if that were true, then it may be reasonable to use that as a placebo, but obviously it's not, because it was only assumption, was never tested. But, it's interesting. Let's get back to the reason why they used those to begin with. That aluminum is used as an adjuvant, and an adjuvant is something that is supposedly designed to increase the immune response. But if we go back a step further, the immune response is really is subdivided into two immune responses: the humoral immune response and the cellular innate immune response. And the adjuvant only increases the humoral immunity. It does nothing with the cellular innate immunity. The challenge is that there is no really good testing system for the innate immune system, but they technically can measure antibody response. So that's what's being used, and aluminum very effectively is able to increase antibodies. But what it probably doesn't do well, and there's not many studies that look at this, is it doesn't increase the effectiveness in reducing long-term immune responses to infections and disease. I mean, it's just so infuriating to see almost every single media just assume that these things work, and they don't. They only work short-term for one aspect of the immune system, not the total immune system. Because when you get a wild acquired infection, it does stimulate the innate immune system, and you have permanent, lifelong immunity, which never happens with a vaccine.
And that was actually a researcher, one of the Nobel laureates from Switzerland, who made that exact point and published in Frank Zigernackel, I think is his name. And he has published extensively making this exact point that the reason or the fact is that the vaccines and vaccine adjuvants stimulate only the antibody immune response, antibody-based immune response is so this fact is the reason why vaccines do not work long-term against many viruses because it's the humoral immune response that confers long-term immunity, and you don't get that with vaccinations.
Well, it's actually the cellular immune response that does that, and
Yeah.
that the vaccines do not stimulate that aspect of the immune system. They fail to do. That's why we need to get it. A tetanus, a case of a tetanus example, it's every 10 years, and now measles was once initially, twice, now 3 times. Now there's going to be probably every 5 to 6 years before a measles vaccine is they change their recommendations because it does not work long term, and the people just don't get it. They just and even for in that time period, there's in a good percentage of people it doesn't work at all. It just doesn't. And it's interesting. They make the assumption that the antibodies are responsible, but there are people genetically born without antibodies.
Mm-hmm.
I think it's called agammaglobulinemia, and these people still resist infections if they get the natural infection. So that's kind of like a clue that there's something else going on here that's not being fully appreciated.
The problem is that people are being brainwashed into this idea that high antibody titers equal protection against diseases, and it's simply not true. And you get proof for that in so many cases where you get outbreaks of infectious diseases in fully vaccinated populations, over 95% vaccinated, and they still get the disease. And then the other side will always say, we need to increase the boosters. It's like, does it ever occur to these people? It's maybe because they're not doing what you think they should be doing.
Yes. Now, as I mentioned earlier, they really don't have a choice because there are no good lab tests to determine cellular innate immunity. But you're in the trenches and you're there right now, and I'm wondering. And obviously, you're familiar with the research tools that are available. Is there anything on the horizon that you're aware of that will be able to measure this aspect of the immune system?
Well, this is not really our area of expertise because we mainly deal with adverse effects rather than
Okay.
efficacy, and we are neurologists, so.
Okay. So unfair question. I'm sorry.
But I know the basics because inadvertently, if you get to discuss the issue of safety, people will come at you and say, but what about all these benefits? And I say, well, prove to me that there are real benefits.
Absolutely. So maybe you can discuss more of what you are doing your research on, and the data that you've analyzed and what you've found in your research.
Yes. Well, we have actually quite exciting new research data, which actually confirms our ecological study, which has received much criticism from CDC and lately from. We've been bombarded by the Canadian media, who gathered some anonymous experts to criticize. Yes. So both Chris and I received yesterday a call from one Canadian news station, and they say, we have some experts who say that your study should have not been published because it's irresponsible to publish such research. And we would like you to answer to their criticism. And I was like, I'm sorry, I'm not answering to anonymous criticism.
Sure.
It was terrible. But basically, what we did in the original study was we gathered data that's available from U.S. Department of Education about autism rates in the last couple of decades. And we have done a similar analysis looking at autism rates in various other countries, like UK and the Scandinavian countries. And we found that the countries that have the heaviest vaccine schedule, so the children are vaccinated with a great number of vaccines, these countries have higher autism rates compared to countries that do not vaccinate children with as many vaccines. And if you look at the temporal trend in the US, you see a significant correlation over the last 3 decades between the number of vaccines and autism rates. And there's just been the autism numbers have been skyrocketing. And they always say, it's only because the diagnosis of autism it's better. But that's again a bogus argument, because just in the last 5 years, there's been about 70% increase in autism over the last 5 years. this is not due to better diagnostic criteria, and it sure isn't a genetic epidemic because genes in the population do not change in 5-year span. So these arguments are just silly. But obviously, correlation does not imply causation. And if you have a theory, a plausible theory, you have to test it. And in the best way we can do this now is in animal models. They're not perfect, obviously, but I don't think testing in humans on this scale is ethical. That should have been done by the regulatory agencies before they approved vaccines. They should have tested vaccinated versus non-vaccinated, the population of vaccinated kids versus non-vaccinated kids, and assessed the health outcomes. But that study has never been done because it has been claimed that it's unethical not to give children vaccines. Well, again, that's an assumption. And if you claim that, don't call me a quack scientist, because your science is quack also, because you're putting assumptions that are untested, and it's the same goes for safety. So what we have done is, again, what the FDA didn't do even with mice, which is let us inject mice with aluminum at the equivalent that's given to the kids in the US. So I'm not putting a horse dose aluminum in a mouse. I'm scaling down to the mouse weight, and I give them exactly what has been given to children.
The same concentration.
The same concentration, and we have spaced it out based on mice developmental stages.
And this is the study that you did.
Yeah, and what we have found is that 6 months later, and mice at 6 months are adult mice, basically. These mice have permanent behavioral impairments. There was an increase in anxiety, significant increase in anxiety, and a reduction in exploratory behavior. And there was also a reduction in social interaction between the mice. And that was a huge there was a huge confirmation that our initial assumption or correlation might have something more to than just correlation. Then we went and did some gene-based studies. So we looked at the expression of genes in mouse brain, and we look at the expression levels of these genes. We selected 17 candidate genes that are involved in neural function and also in immune response. And we looked if there is any change in their expression, both at the gene level, at the protein level. And what we found was a significant increase in tumor necrosis factor alpha, interferon gamma, and also a chemokine called MCP1, which is a macrophage attracting factor. And we also, and so these are markers of inflammatory response in the brain, in mice that were now adults. And we also found a significant decrease in a neurotransmitter, acetylcholine esterase, which is involved basically, well, in many functions, but one of the function is related to the depression and anxiety. So again, there was a reduction in this neurotransmitter. And so what we saw at the gene level and the behavioral level is consistent, because we know from studies done on deceased autistic patients that they have chronic inflammation in the brains. And also, autism it's not obviously just a brain disorder, it's an immune system disorder. I call it an immune system brain disorder. They're connected. These two systems are connected. And the research, the basis or the backbone of this research has been done, 30 years ago. We already knew that there is a significant connection between the immune system and the central nervous system. They communicate. And you cannot influence the immune system at the periphery without changing something in the brain. And most of us know that from experience, because when you get the flu, your brain doesn't function very well. It's that mental fogginess and also chronic fatigue, but there are also clear, neurobehavioral changes, because again, there is this what it's called neuroendocrine. It's a neuroendocrine axis, and basically the immune system at the periphery and the central nervous system talk to each other. And again, if you increase an immune response artificially in the periphery, you are going to mess up the brain. They've done that artificially with using what they call viral and bacterial mimics. I was like, oh, well, that spells antigens and vaccines, because that's exactly what's being used. And they also obviously add some strong adjuvants. They exaggerate the effect, and they get this was done in rats and mice, and they get similar types of behaviors that we saw in our mice, increase in anxiety, reduction in exploratory behavior. Depending on how severe is the intervention is, they might get increased propensity to developing seizures in these animals. So again, there is a huge body of research that shows that if you overstimulate the immune system at the periphery, especially in critical stage of early development, you are going to influence the brain in a negative way, influence the brain development, and you can create irreversible damage. And again, this is a research that's rarely discussed, because it really shows that there is there is a reason to truly question the safety of the burden of vaccines given to infants.
And one of the reasons it's so rarely discussed is that the media essentially has captured the entire conversation, basing it on the foundation that Andrew Wakefield, when he does his research in the late 90s in MMR and his supposition that it increased the incidence of vaccines and that may be related to mercury, well, they did these, obviously this distressed the vaccine maker, so they had all these studies and conclusively, scientifically, in quotes, proved beyond any shadow of a doubt that it was not the case. Yet, we still have, when I was in medical school, 35 years ago, the incidence of autism was 1 in 10,000 children. Today it's 1 in 50, and that's conservative. And it's going up to 1 in 10 to 1 in 2 if things don't change. That's just insane. And if you've seen an autistic child from across several gates down an airport, it's an autistic child. I mean, you do not need to be a rocket scientist to diagnose these children. It is so easy to do. I mean, the behavior is very characteristic. You don't need this intensive battery or blood test or anything. It is just reprehensible that they could even insinuate that that's the case. So now your research, I have some questions for you. Is it mostly pinning the blame on the aluminum as an adjuvant? And the research you did, does the technology that you did to incorporated to measure these neural parameters, is that something recently that was done? In other words, could they have not done it 10 years ago because of development in technology?
Oh my goodness, this is such a basic research. They could have done it. They could have done it 20, 30 years ago. This is not rocket science research.
Okay. That's sad to hear, but that's the truth.
And back to your question again, the aluminum on its own is a neurotoxin. But the fact is, it's not simply aluminum. It's the fact of this exaggerated immune response. So if they replaced aluminum with another adjuvant, you would still get the problem.
Okay.
And there is another aspect which we investigated in Israel last year, which is the cross-reactivity between the cross-reactivity between the antigens, the antibodies that are raised against vaccine antigens. Some of them cross-react with our own tissues, because we know that many viruses and bacteria share genetically similarities with, there could be a peptide sequence, say in the bacterial wall or in the wall of the virus, that mimics the structure of a human protein. So the antibody that's raised against the virus will then also recognize these epitopes in our own tissues that mimic the virus. And we have demonstrated this effect in HPV vaccine because we had, again, we have done a test where we vaccinated young mice with, again, the equivalent of what young girls are receiving, so 3 doses of Gardasil. We vaccinated them with Gardasil, and they developed anti-Gardasil antibodies or anti-HPV antibodies. And what we found is that if you coat a plate with HPV antibodies, and if you apply the serum from the mice on this plate, serum from the mice that have been vaccinated with Gardasil and have concentrated antibodies in the serum, you get the binding between the antibody fraction and the HPV fraction that's on the plate. Now, if you co-apply a mouse brain protein extract, you get inhibition of binding of the anti-HPV antibodies to HPV. Why? Because they are preferentially binding to the mouse brain protein extract.
Wow.
And
so does that imply an increased risk for brain autoimmune disorders like MS?
Exactly. It increases the rate of any immune-mediated nervous system disorders, which incidentally appear to be the most commonly reported worldwide following Gardasil. And we have done this analysis, and we published it in Annals of Medicines, where we took vaccine safety databases from various countries, and then we rated the adverse effects based on organ system. And so we found that the most commonly reported are nervous system disorders of immune origin. And what was interesting is that in 2013, Japanese pharmacovigilance picked up our paper, and I had an email from a doctor saying, can you send us the raw data, because we would like to add our Japanese data to your set and see if they match. And I said, yes, please do. And the match was perfect.
Big surprise.
The match was perfect. And after that, the Japanese pharmacovigilance called a government and health authority-based hearing on their concerns about the safety of HPV vaccines, because again, they were introduced in Japan and universally recommended, and there were many adverse effects. And so after the hearing, which was, I was present at that hearing last year, they decided to basically stop recommending the HPV vaccine.
This is in Japan.
In
you
Japan.
Were at that here?
Yeah.
Okay.
And so again, there are governments that are, I guess, not as corrupt, and they're willing to engage in a rational dialogue.
That is, was not aware that Japan had stopped recommending HPV, in large part thanks to your research.
The first kind of halt was made in 2013, and then last year it was like reinforced. The problem is that most of this news is in Japanese. and obviously Western media is not going to cover it, but Merck was, there are reports, and Merck was very concerned. I found a report on Fierce Vaccines, which is the pharma-based, is their website, and they were very concerned because of Japanese government and how it's going to affect their sales.
Sure. Well, what else would they be concerned about? They're not concerned about helping people. They're concerned about the bottom line.
No. So they had to send their experts to Japan to try to ration Japan into introducing back the recommendation for HPV.
But to this date, it's still not recommended.
No, to this date, it's still not recommended.
So the use or the adoption of that is, I would imagine, radically decreased. It's probably still voluntarily available if one is convinced of the pharma propaganda,
Exactly.
but it's not mandated.
Exactly. And there was a paper recently came from Japan, and again, trying to reverse the damage that's been done by
Well,
terrible decisions.
Yeah, large kudos to you for making that happen. It sounds like yours the research that triggered that whole process. So congratulations.
There were more. I wouldn't take the credit. There were many. There were other scientists, our colleagues from France and also from the US, and many Japanese scientists that have openly raised their concerns. People. There was a physician there who treated over 20 cases of MS after Gardasil, and his testimony was very important because the pharma people were saying, their classical spiel on this issue is that it's all psychogenic effect. and so it's like, really, how can a psychogenic disorder cause an MS lesion in the brain? And they didn't have an answer to that.
Oh, jeez.
And we are talking about perfectly healthy girls that all these problems started in temporal association with the vaccine. So just out of precautionary principle, you would think that they would have the common sense to at least halt the use until more research is done. But no, they just want to force it, and they parrot that it's safe, and they do not have any proof other than manipulated research.
Well, I can assure you that large numbers of people, millions, will be exposed to this truth that Japan has stopped the mandating, and based on the research of your research and the research of other scientists who really linked the connection between HPV vaccine and MS and these autoimmune disorders. Now, I'm aware of some other research that suggests that the absorption of aluminum by injection, intramuscular injection, is close to 100%, whereas if you swallow it, it's only maybe 1% on average. So it's 100 times greater. And do you suspect that this has some influence on it, or is it just because the fact that it's an adjuvant that's causing the problem?
Yes, definitely, it's got the influence. And when you mentioned the research, well, it was the team from France, from Créteil and the INSERM Institute in France. They were also present in Japan, and they were presenting this data from animal experiments where they shown that if you inject the alum adjuvant, that what happens is a portion of aluminum is engulfed by the macrophages, and some of these macrophages eventually find their way to the brains of the mice. Mm-hmm. And so it's dependent, the transport in the brain, it's dependent on the same chemokine, MCP1, macrophage chemoattracting protein, which we found increased in our animals that were exposed to aluminum. Because if you have MCP deficient mice, then the transport to the brain does not occur. And so the macrophages engulf aluminum, and a portion of them ends in the brain. And the problem is that it accumulates. So these vaccine-derived, if you like, aluminum stays in the brains of mice up to 1 year after injection, because there is just no way of getting it out of the brain that we know of. There is no recirculation. So and this is a common problem with aluminum, because it's got a strong charge, 3+. And mm-hmm. what they found is that in Alzheimer's disease patients, the chromatin fractions, so in the nucleus of the cell where your genetic material is stored, mm-hmm. are basically, they accumulate aluminum, they bind aluminum, because the DNA has a negative charge on the outside, so it binds the positive aluminum. And it disrupts the formation of chromatin, and it also can, they found in Alzheimer's disease patients that aluminum binds to selective promoter areas of genes that encode genes that are essential for neural function. So it inhibits the expression of these genes. And again, the problem is that once the aluminum gets into the nucleus of the cell, there is no way of getting it out. And it just stays there. And the finding by the French team that even the aluminum you inject in the periphery can get into the brain is a concern.
Mm-hmm.
And
Absolutely.
Because it adds, obviously the vaccine derived aluminum is not the only aluminum we get through diet and inhalation, but it's exactly as you mentioned. The fact is that the aluminum we get from vaccine is not rapidly excreted, and most of it does remain in your body because it bypasses the gastrointestinal system. Mm-hmm. And if it was rapidly excreted, as they would like us to believe, then it would be a pretty lousy adjuvant.
Right. So even though the FDA and the vaccine researchers assume that it's safe, any credible scientist who has examined this knows it's a very potent neurotoxin. But you had mentioned earlier that, if this fact becomes widely known with the community and that there is a movement to remove aluminum as an adjuvant, your suspicion is that any other adjuvant, even though it's not a potent neurotoxin, may have a similar autoimmune response resulting in neural autoimmune diseases.
Simply by the virtue of overstimulating the immune system, you run the risk into breaking self-tolerance. And this is another important research that was presented in Japan at this governmental hearing about the safety of HPV vaccine, and which was astounding research. And I have had an honor to talk later with the researcher. And what they found is that the repeated stimulation with the same antigen overcomes the genetic resistance to autoimmunity. And what are we doing with these vaccination schedule where we are boosting in short intervals? We're giving boosters to children every few or so months with the same antigen. Again, it shows if you just stimulate the system on a regular basis, you're going to break the tolerance to autoimmunity. What they've done is because you have many strains of mice that have a genetic defect, so they're genetically susceptible to develop autoimmune diseases. So they don't need a strong stimulus. But what the research from Japan has found that in mice that are normal, if you drive the immune system too much, you get the same effect.
So I guess there's a new 9-valent HPV vaccine?
Yeah.
And I suspect it's going to generate, as opposed to the 4-valent one, over twice as many. So the concern there would be it would generate an even stronger immune response.
Yes, plus that, yes, it's got the double dose of aluminum.
Okay. Perfect. So you've presented some very compelling information for avoiding this very dangerous vaccine. My perspective, it's one of the more dangerous ones that could possibly be injected anyone, let alone young girls. And now the recommendation, of course, is for young men to have this injected. It's just so irrational. So are there any common sense recommendations that you might have for protecting ourselves? I suspect that avoiding the vaccines might be one good one, but there's some other things that we can do.
And avoiding unnecessary vaccines, yes, it would be a good one. And everyone has to take responsibility of their own health and do the research, because I don't trust anything that comes from the FDA. I've just seen. I love it. People think that Vioxx is an isolated incident. How can you trust an agency who allowed close to 140,000 Americans to suffer heart attacks?
Yeah, and
before they
60,000 have died.
and
And
60,000 died before they pulled the drug off the market, and it's
no,
only
no,
because
no, they didn't pull the drug. Merck pulled it voluntarily in
okay,
2004. And Merck, by the way, is the same company that makes HPV vaccine.
yes, yes,
The same criminals, set of
yes.
criminals.
And these are not isolated incidents. That's the problem. So when I looked at what they approved and what testing has been done and the quality of testing, it's like, I'm sorry, you're not injecting me with anything that FDA approved, only over my dead body. And you can call me a radical, but I've spent many hours researching this, and I'm simply the science tells me otherwise. And the problem is that, you know, as you said, even in the 70s when I was born, they did not give us 30 doses of vaccine in the first year. I received some vaccines, and most of my generation have, and that generation didn't have 1 in 50 autism rate. And in those days, there were no big epidemics of so-called vaccine preventable diseases. So even if they would have the common sense and say, let's go back to what we did 30 years ago and see if that solves the problem. But no, they want to push this policy, one size fits all. And you either have to adhere to the CDC mandated schedule, or, well, now they want to force it on everyone.
Mm-hmm. Yeah, that's the big push, and they've been really effective. I've never, ever seen a more aggressive campaign to vilify anyone who opposes the vaccine schedule. I mean, at least in America, I don't know how much you're exposed to the U.S. media, but it's been unbelievable. I never thought we'd see this soon.
Yes, I have followed that, but what is so disturbing is that, because I have a big network of people, the same propaganda is happening in Germany and also in my home country, Croatia. And it's like they're reading from the script. They told me that the Croatian representative to the European Parliament in Croatia said that vaccination is not an individual's choice. It's a public health issue, and that everyone who refuses to be vaccinated is a danger to society. This kind of propaganda is being spread everywhere.
Yeah, I hadn't realized it had. I'm not surprised, but I hadn't realized it had gone that far, even to Europe. And that's so sad. Because I mean, it's not surprising because so many of those countries follow the U.S. media, so yeah. it would make sense. But it's sad nevertheless. So, oh man, this is a really powerful pieces of information you've provided us, and as such a credible researcher, who's really been able to document this objectively and independently, and with your previous position of taking the high integrity move and actually quitting your job because they asked you to falsify data, which is so prevalent. I forget the rates, but we've done articles on the past, but it's at least 10 to 20% of the studies that are published have falsified data.
Yeah, because the money drives research, and who's got the most money to fund research?
Yeah, usually it's the drug companies or the government, when the government's agencies, many of which are corrupted by corporate influences, and they direct those funds.
And there is so much hypocrisy, because they will, the ones who criticize our research will say, well, you are sponsored by private donors, and they're anti-vaxxers.
Yes.
And I'm like, well, Merck is not going to give me money to do this type of research. We try to apply to governmental agencies and they say there is no use it's a waste of funds because everything has been debunked by the Andrew Wakefield study. And I'm like, yeah. We are not researching even MMR.
Right.
So does MMR close the question on aluminum? So and
they never looked at aluminum.
They never looked at aluminum. And the family that sponsors us, the Dwoskin Family Foundation, they're not anti-vaxxers, and they're not anti-vaxxers, and I know that for a fact because well, I don't want to speak for Claire now, but they will make this statement, and it's like, have you interviewed them? Have you bothered? Or is it just you don't like what they found, which is independent research? So you have to put a label, because you cannot make credible criticism to the study. Mm-hmm. But at the same time, you're being a hypocrite, because you're not looking at all those studies that claim that vaccines are perfectly safe and effective. You're not looking at who's funding them. So that's a double standard.
I've got a personal question for you, because I've interviewed many other researchers who were part of a large university, as you are, and when they published findings that were conflicting with their research support grants, they lost their positions. So you appear to have independent funding, but I'm wondering if you've received any pushback from your university about these studies.
Our university has actually been great, and it was because, again, there are people in our academia here, and UBC really stands for academic freedom. Mm-hmm. And it was when Chris, my boss, was interviewed several weeks ago by a station, a Canadian station, and again, they didn't like what he had to say. So then they made these threats. We're going to now call your university, and we're going to investigate about this anti-vaxxer Dwoskin Foundation that's sponsoring you. And they really got a polite slap in the face by our department. Because terrific. They said, they said all the studies have been peer-reviewed, the funding has been disclosed. It's not that we're hiding. So people can make an informed choice. Mm-hmm. And the studies, we didn't publish them out of our own sovereign power. They went under peer review. Mm-hmm. And they were not published in obscure journals. I mean, our HPV vaccine paper was published in Annals of Medicine, for example. Wow. And I found a comment by those pharma-sponsored people that have nothing better to do in their lives than criticize other people's research on the blog, saying how the standard of Annals of Medicine has eroded because they allow this blasphemy.
Well, you're hitting the core. You're obviously in research and not a practicing physician, but as a physician for the last 3 decades, I can tell you that the last position that any physician will move on is the abandonment of vaccines as a primary intervention for preventive medicine. They held it at the core of it's the most foundational basic belief. And it was true for me personally. I mean, it was the last belief I gave up when I made the transition to natural medicine. So it's not surprising to see that type of response because it's so central to the core of everything they believe and are taught. But are there any other examples that you can give of some of the criticisms that have been thrown at you for publishing this study?
Well, it's just basically ad hominem. They say it's irresponsible. The latest one was it's irresponsible to publish this type of research because it's going to supposedly erode the confidence in vaccines. And I'm thinking, I think the opposite is true because if you're trying to enforce military measures, I think that erodes the confidence because a truly good product does not need military type of enforcement.
That's right. People will be flocking to get it if in fact it really does work. It provides benefit without harm. But the big central issue is that essentially there are no safety studies done. Properly performed safety studies. There are probably a number of safety studies, but they're corrupted and done improperly with placebos which are not placebos.
Yes, and again, we're not saying stop vaccinating, but stop selling lies that these things are absolutely safe and that, serious side adverse events are so rare that you don't have to worry about them. It's a lie because the proper type of research to answer that question has never been done.
Yeah, I couldn't agree more. And then especially when you take that realization or recognition, that fact, and you superimpose that on the historical record, which Dr. Suzanne Humphreys, I'm not sure if you read her book Dissolving Illusions, magnificently does. I mean, most every one of these infectious diseases were reduced by 99% or more before the introduction of vaccines. So there's these nutritional hygiene principles which are far more important at preventing disease, like breastfeeding your child, giving him vitamin A and vitamin D, avoiding sugar. The common basics which virtually eliminates any morbidity and mortality from the infectious illness. And not only that, but provides lifelong immunity.
There is also research that I have in my archive showing how exposure to certain childhood diseases like chickenpox actually has prevents certain types of gliomas.
And that's a brain tumor.
Brain
right?
tumor, exactly. And there are some others that decrease the risk of Parkinson's. And again, some of these diseases, cancer is also in part a disease of the immune system, because a healthy immune system will detect abnormal cell growth. But if you but if you mess up your immune system early in childhood, then there goes your anti-cancer defense.
Yeah, which is precisely what we're doing with this aggressive, inflated immune schedule that has just rapidly accelerated in the last 10 to 20 years for relative to where it was before. I mean, it potentially had problems when it was first introduced, but it's only been magnified with the increase in the adoption of these vaccines. And new vaccines like HPV, which you've clearly documented, are not without risk. So I really commend you for your diligence and your integrity and doing this research, because there's not many people like you that are bringing these facts and science to the public, and we'll do our best to make people aware of what you've been doing. But are there any other comments that you'd like to make or insights that you've done through your work?
Well, one can go to no end, but I think the message is out there. People need to do their own research on these things, because, if we have to make choices every day, and they should be informed choices. And I'm thinking, if I was to buy, I don't know, a new kitchen appliance, I would spend some time researching, comparing prices, and looking at the quality. But when it comes to putting things into our children, we just blindly trust the medical authorities.
Yes.
And again, this is not a question you can answer in 5 minutes.
No, you have to do diligent study. There's no question.
But your children are worth it.
Mm-hmm.
Nothing can replace a dead child. And I'm sorry to be so blunt, but or
even worse, a severely neurologically compromised child for the rest of their life, who's handicapped and will generate millions of dollars in fees that are in taking care of them.
Yeah, you cannot go back on some of these things, and I get a lot of emails from parents, and it must be the most horrible thing for a parent to live with that, because they truly believe they did the best for their child. I know many mothers whose girls have died following HPV, and they said, if I only hadn't listened to that campaign, my daughter would still be alive.
Yes. So I couldn't agree more. It's one of my passions to inform people about this issue, because it's a really serious challenge. So, my strong encouragement to anyone and everyone listening to this is to pass this interview along to anyone you know who's considering this, and have them carefully listen and do the diligent, independent research, and not to be snowballed by their pediatrician or their primary care physician into blindly accepting this without doing your own research. You just simply have to do your due diligence. So, again, I really commend you for your work and effort, and I suspect, you're born in the 70s, so you got many decades of great research coming ahead of you. So I'm glad that you're doing the independent, objective work that needs to be done to document the safety issues with these vaccines.
Yeah, well, thank you, and yourself, because you can certainly reach more audience than we can.
Well, that has been my mission. I recognize there's valuable information out there that needs to be spread, and that's what we've adopted as a platform to help share this information, and we've done it pretty effectively. So we've got 10 million unique visitors a month that help spread the word out there and really challenge the propaganda that is being promulgated by the media and most of the public health authorities.
And you put it in a way that's understandable without... the problem of scientists can be too much technical jargon.
Yeah, I translate it for them. Right. Yeah, I'm a translator. I'm a medical translator into typical contemporary English language. So it's and the sad reality is that many professionals don't understand or realize that, but it's an important role because if people can't understand these complex terms, they're turned off and they'll stop reading or listening. So, I mean, you used a number of them in there, and I understand what they are, but we'll have to translate some so that people can really get the full end. But I think that anyone can understand that you're doing magnificent research. You provided, some of the core findings that led to the abandonment of the mandating of the HPV vaccine in Japan, and I had not until this interview realized that we had that victory under our belt. So that's great news. Some of the best news in the vaccine front I've heard. It helps balance out the media vilification of those who are opposed to blindly accepting the mandated vaccine schedule.
Yes, it's only unfortunate that it hasn't gone further in the media, but
it will.
I can provide you with the links that at least that there is an English based pharmacovigilance website from Japan that has the links.
Perfect. All right, we will definitely put that in the article. Well, thanks so much for all your work.
Thank you, Dr. Mercola.